Good day and welcome to this webinar from Retina South Africa. I am Karen Denton, and at Retina South Africa I'm involved in education and advocacy. A quick disclaimer, this program has been made possible thanks to an unconditional grant from Bayer South Africa. We're going to talk about art, artists, and the effect that their vision had on their art as time went by. First of all, many famous artists presented with a variety of visual problems. A few of them, in fact, had more than one pathology. Some were labeled as visually impaired based on their art, and many showed deteriorating vision with age. As we look at a few of these artists, ask ourselves, what effect did vision have on each one's work versus their artistic approach? We're going to start with Armagan. He's a Turkish artist who was born blind and taught himself to paint at a young age. He still lives in Turkey and produces a vast number of artistic works. And as you can see, he's able to produce the most beautiful, evocative artworks simply by touch and feel, using his other senses and probably his inner vision to represent what he sees in his mind. In the second painting that we have here, we see a beautiful snowy scene with chalets, trees, and a road that wanders off somehow into the far distance, taking us into a land of who knows where. The next artist we will look at is El Greco. He lived in the 16th century, and for a long time we believed that he had severe astigmatism. This causes a deformation of the light entering the eye with a unidirectional elongation of objects. And yes, he frequently did elongate the figures in his paintings. Let's have a look at this one. If you look at this man, you can see that he is disproportionately elongated. But if we look a little closer, we see that he actually elongated his figures in all planes, vertically and horizontally. And the hands in this case are appropriately painted with a length that matches the vertical perspective that he has given. And not only that, we also know that only some of his figures were elongated, and in fact these were usually of religious significance. So, this leads us to conclude now that his artworks were probably a deliberate stylistic choice. However, there are other artists who may have been affected by stigmatism if we look at their artwork now. These include Holbein, Botticelli, Titian, Modigliani, Sargent, among others. Let's have a look at Claude Monet, a very, very popular artist who lived from 1840 to 1926. Now, in the early 20th century, Claude Monet developed cataracts, but he was terrified of cataract surgery because a friend of his, Mary CASSATT, had lost her sight after surgery. However, we now know that her problem may have been due to untreated macular degeneration rather than the complications of surgery. But looking at Monet's artworks, the bottom line is there are massive differences in his work before the cataracts developed and post-operative. And although he destroyed dozens of his artworks, enough remain for us to draw a comparison. Monet famously loved to paint the lily pond in his garden, and his many depictions of these water lilies are found in museums across the world and on many other surfaces as well. An added favorite to paint here included the Japanese bridge over his lily pond. And this is another scene that he produced many times. Here we see a beautiful depiction of the bridge painted in 1899. If we look at exactly the same scene after he developed cataracts in 1922, you can see that not only is the bridge barely discernible in this picture and the water lilies are difficult to find, but the colors are completely bizarre. And in fact, it is hardly surprising that when he finally consented to a cataract extraction, and he only agreed to one eye being operated on, that he was so dismayed by the artwork that he had produced during this time that he burnt and destroyed whatever he could find. His family actually salvaged a few pieces, and the few that they managed to keep are the only ones that remain from that time. If we look at another painting done after his cataract surgery, you'll see that once again, even though he only had surgery to one eye, his visual acuity and his color perception are vastly improved. And now we move on to Edgar Degas. There is a huge amount to say about his visual problems. First, because a close cousin had an identical problem, we surmise that his eye disease was most probably genetic. What we do know is that he had started to lose central vision by the time he was in his 30s, and by the time he was 40, he had significant loss of vision that had a massive impact on his artwork. Hilaire Germain Degas, popularly known as Edgar Degas, lived from 1834 to 1917. He had progressive retinal disease and he had lost central vision by the age of 40. He was first thought to have AMD, macular degeneration, but we now think it might have been Stargardt's because the age of onset was long before he was 40 years old, as he'd already lost his vision by the age of 40. He complained regularly, almost throughout his adult life, of infirmity of sight. He avoided glare and elected to work only indoors. His artwork shows that his visual acuity deteriorated rapidly, and in the 10 years, by the time he reached the age of 50, it was only 2200, compared with 2040 at the age of 40. And in his 40s, his right eye became permanently, irreversibly damaged. By 50, he could no longer read any print at all. If we look at his earlier works and just follow them through time, we see that his vision certainly affected his paintings. In this work that he produced in 1865, you can see that the detail is meticulous. Just look at those eyes, her nose, the earring, that are all shown in exquisite detail. And those precise individual brush strokes showing the flowers, the petals, each one distinct. And then we notice the cloth lying on the table, the wallpaper in the background. All aspects of this work are clear and draw one's eye to more and more that is shown with that exceptional artistic clarity. But if we look 10 years later, we see that already in those 10 years, he has lost a lot of visual acuity. Gone are the sharp defined lines. His accurate brush strokes are no longer there. They've become much softer with far less definition. His paintings even take on an ethereal quality. You can see that he uses wider, more casual brushstrokes against a rather indistinct background. In addition, DEGAS had lost the ability to differentiate color, and he had to ask his assistants to help him with this. And he also resorted to using very bright colors that he could actually see. A mere 6 years later, his paintings are almost sketch-like. They are coarse and blurred and are a stark contrast with his earlier meticulous, precise brushwork. At the same time, more intense colors allowed him to at least differentiate some of the colors in his art. These three nudes again depict how Degas' vision deteriorated with time. The clearer, accurate brushstrokes of 1886 are replaced by rough, inaccurate strokes. And a close examination of the 1905 model shows a rather unnatural right arm. It is not surprising then that it was at this age that Degas gave up painting altogether and concentrated on a more tactile art form. He rather dramatically stated that he had to learn the craft of a blind man as he took up sculpture, producing many masterpieces. In summary then, as time passed, Degas tried to adapt and change his artistic style to suit his failing eyes. He left many works unfinished as he was very dissatisfied with them. We know that his cousin had a similar eye condition that left him terrified of blindness, and it is very sad that for the last 15 years of his life he was completely blind. However, as we have seen, he did compensate with some wonderful, absolutely beautiful sculptures. If we look at the treatment available to Degas in those days, we really had no effective treatment for retinal disease at all. He did try numerous spectacles, some of them tinted with different colors. He tried to occlude his damaged right eye, but he complained regularly that he could not wear them for work, and in fact he refused to wear them at all. He always avoided glare, as we mentioned, and he preferred to work indoors, typical of people with macular problems. However, had he been around today, we would have started him very early with appropriate lifestyle choices, a really good diet, not the popular brown and white diet that we so often favor. Rather, a diet rich in the essential nutrients and antioxidants found only in foods with color. Plenty of green leafy vegetables like spinach and kale, but also include the other colors of the rainbow, like the red found in tomatoes, yellow in squashes and corn, and the orange color found in pumpkin, carrots. In other words, we would have encouraged him to eat from every color of the rainbow every day, because that does provide protection for the retina. Smoking was certainly not regarded as a danger in Degas' time, but today we would encourage him to limit his smoking, or preferably to give it up completely. And alcohol. The alcohol that was available then was often very harsh and could be very, very damaging, especially to the nerves, including the nerves to the eyes. Today, we would ask him to limit his alcohol to a moderate intake. And these days, he would have had the benefit of anti-VEGF injections when the vessels in his retina started to leak and cause problems. And then last but not least, we could have trained him using PRL, which is preferred retinal locus, using the Maya machine that we will discuss in a little more detail later. If we had been able to diagnose Degas earlier, maybe with dry AMD If this was his diagnosis, remember we would only be able to determine that with today's technology. But had he been diagnosed with dry AMD, one of the AREDS 2 formulations would probably be prescribed. And these are very important because they contain lutein and zeaxanthin, which are both essential for the health of the retina. And there are so many different trials and research going on around the world into retinal conditions, and many of them show very promising outcomes. And then, as we mentioned a moment ago, PRL, the preferred retinal locus, because people like Edgar Degas experienced less distinct direct vision because the macula, where your eyes usually focus on an object, is damaged. They complain of loss of vision, loss of acuity, inability to focus on anything, recognize, read, etc. PRL retrains the other healthy cells in the retina to, as it were, take over the function of focusing objects. And here we see the healthcare provider busy assisting and helping a patient in exactly this. In this way, PRL assists the patient to retrain the healthier cells in his retina to take over that essential function of focus. This brings us on to Rembrandt. He lived in the 17th century. His earlier works show a tremendous mastery of detail, light sensitivity, wonderful acuity, and almost perfect contrast. But his later works start to show reduced detail, reduced clarity, reduced light sensitivity, and the fine brush strokes and careful precision that are so typical of his early work give way to loose, heavy, less clearly defined work. So the thinking is that he probably had macular degeneration, although obviously we cannot be 100% sure. His artwork certainly does demonstrate that. Before we even look at the effect of aging and macular degeneration on his artwork, let us quickly acknowledge another visual defect that Rembrandt almost certainly had, and his self-portraits definitely confirm that he had misaligned eyes, in other words, a strabismus or squint. And the type of squint that he had was a divergent squint or exotropia. This meant that it is very doubtful that he could see his world in 3D. He saw the world then as flat, two-dimensional, without any depth perception. In fact, we need both our eyes in good alignment to be able to appreciate depth, what we call stereoscopic vision. But 2D vision was quite an advantage for him. Most artists have to translate their 3D world into 2D before they're able to capture it on canvas. Because Rembrandt already saw the world in 2D, he could capture everything exactly as he saw it. Let's have a look now at how age and advancing age affected his artwork. So if we look at a very early work, you can see it is incredibly precise in its depiction of the scene. Every detail in this painting is represented with fine, meticulous brushstrokes. Just look at that donkey and the prophet, each depicted with photographic-like clarity. The biblical story virtually unfolds before us. A donkey that could see the angel that was invisible to everyone else. The donkey falls to his knees and is beaten by Balaam, who eventually also sees the angel. Even the lack of comprehension on the donkey's face, you can almost see it asking, why can Balaam not see what he can see? Every detail in this painting is perfect. And if you notice, it was executed in 1626 when Rembrandt was just 20 years old. In this image painted just 13 years later, we can already see that a softness has crept into the work. The crispness that is so evident in his earlier works is replaced by a degree of, as we said, softness. The ruff and the facial features are still clear and well defined, just not quite as precise as in his previous works. And then, in a religious work completed in the same year, we can actually see the same soft, blurry effect. However, in all of his works, Rembrandt is known for his incredible, masterful use of light and shade. This mastery is probably also attributable to his 2D vision. And then, as Rembrandt advances to an older age, we see that his brushstrokes are rough and rather representative of the subject, instead of the precision that he applied earlier. The images produced at this time are still absolutely magnificent, but we see far less use of color. This has also led many to speculate that he had developed cataracts as he aged. But his masterful use of light and shade never diminished, and even his latest works are a tribute to his superb ability as an outstanding artist. Let's have a look now at Renoir. Renoir lived from 1841 to 1919. He had significant myopia. He had difficulty seeing anything in the distance. He used this to his advantage when painting. And his backgrounds, if we have a look at them, are perfectly blurred, the way he actually perceived the background to be. He created contrast with a blurred background and a detailed foreground, and also in his close-up paintings. But not much changed through the years with his work. If we look at this painting, I'm not going to try and pronounce it, Le Renoir, painted in 1869, we see that the trees in the background are just a suggestion of trees. No precise brushstrokes, no clear definition, and if it weren't for the setting, we probably would not even be able to recognize these as trees at all. They're simply a blur of different shades of green, light and dark here and there, and just a hint of a branch in between the green foliage. And you can compare this with a foreground that has much more detail. You can see the individual leaves, the different boats, people, and even animals. And then 12 years later, we see a similar contrast between the foreground, which is drawn in quite a lot of detail, and the background, where once again the trees and the figures in the background are quite indistinct, are really just representative of what they're meant to depict. And then finally, this painting was produced between the two, and you'll see that this was a technique that he exploited to a greater and lesser extent. In this case, although the figure is not sharply defined, the background is even less so. Paul Cézanne lived from 1839 to 1906. He had diabetes that was triggered by poisoning because he used his fingers to paint with oils. And in those days, the oils were lead-based and absorbed very rapidly through the fingers. This led to him developing quite a severe diabetic retinopathy, together with a resulting blue-green color blindness. This was compounded by quite a severe myopia, but he refused to wear what he called vulgar glasses, considering them completely socially unacceptable. His painting then became increasingly abstract, and in fact, he is often thought of as the start of the post-impressionist movement, bridging that gap between the Impressionists and Cubism that followed soon after. Cézanne was a prolific artist with more than 900 paintings to his name that hang in museums and private collections around the world. This does not imply that they were in any way inferior. And in fact, one of his works, depicted here, the card players, sold in 2012 for $250 million. But let's have a look at his artwork through the years. We'll begin with this painting, circa 1867 to 68. We see a clearly defined painting with sharp brushstrokes. It depicts a fellow artist with all the deformities that ailed him. 10 years later, we see paintings of Cézanne's wife and his son, and immediately notice that these works are somewhat rough. They have a sketch-like quality and are beginning to lose the clarity that he exhibited in earlier works. And then 25 years later, his works clearly show the development to post-impressionism. Sadly, Cézanne was outside one day painting in the rain, and he started to make his way home when it appears that he fell into a diabetic coma. He was found by a passerby and taken home, but he died a few days later from pneumonia compounded by the diabetes. His treatment today, we would have diagnosed both his diabetes and his myopia really early. We would have immediately tried to control his diabetes. We would have given him a diet rich in color, and we would control his simple carbohydrates and fats. We would limit both saturated fats and trans fats. Luckily, trans fats were not as available in the time that he lived. We would have recommended appropriate exercise, and it is ironic that he died while on a walk when he went into a diabetic coma. We would ensure that he ceased smoking and limited his alcohol intake, and that he would take all his medications, insulin, etc., as indicated. So today he would have a far different prognosis from those days. Not only that, we would address his complications really early, and the neovascularization that we believe developed in his eyes, we could have treated with anti-VEGF injections. Maybe laser, but that's really gone out of favor these days. Steroids could be used, and then, as we mentioned before, the Maya, to retrain the eye to use undamaged, healthy retinal cells that are still capable of sharp vision. Mary Cassatt is a more recent artist. She lived 1844 to 1926. She was a close friend of Degas, and she also knew Monet. She developed cataracts, and tragically, her vision deteriorated rapidly after cataract surgery. But we now realize that this was due to opacity of the posterior lens capsule. She was also found to have diabetic retinopathy. This affected her red, green, and blue, yellow perception. And the main problem was that all of this happened just when the First World War was raging. Therefore, her access to good medical care, her access to a good ophthalmologist, to appropriate interventions at the time was curtailed. And because of this, the second cataract operation to the left eye was only performed after the war in 1919. And because of the long wait or because of other problems, may be damage to the eye caused by diabetic retinopathy. She was in fact left with very, very limited vision. Because diabetic retinopathy has a marked effect on the fragile blood vessels that nourish the retina, areas of not only the macula but also the entire retina can be affected by diabetes. The individual will be asymptomatic for a number of years, as was certainly the case with Mary CASSATT. And they only realize that there's a problem when they start to notice symptoms, for example, the dark patches that we'll discuss in a moment. In addition, unstable blood glucose levels cause blurred vision, and people with diabetes can develop diabetic cataracts. It appears that Mary CASSATT probably had blurred vision from her uncontrolled diabetes, but in addition, she most probably had diabetic cataracts. The neovascularization, the new blood vessels that are formed in an attempt to overcome the problem of damaged vessels in the retina, can start to leak. They also cause macular edema, and this interferes dramatically with vision. The patients start to complain of seeing dark patches, and in fact, with the damage and scarring, this can lead to retinal detachment and blindness. Mary CASSATT felt that after her cataract operation, things went from bad to worse. However, we now understand that her cataract extraction most probably unveiled and revealed her underlying pathology and damage that we can associate with diabetic retinopathy. And we know that patients even today are often confused when cataract surgery unmasks their underlying pathology, and they then blame the surgery. Now, let's compare just two of her artworks. And in fact, it's not even necessary to point out the photographic-like quality, sharpness and precision seen in this painting during Carnival. The women throwing flowers at the carnival are clear. Every feature is distinct. And in fact, the entire painting looks very real. As we've said, almost photographic-like. But then when we look at a depiction of a mother holding her baby, painted in 1914, shortly before she stopped painting altogether, we can see that Mary CASSATT's vision was poor. Her color perception was definitely affected, and although this is another gorgeous painting, there is almost no comparison with the type of painting that we saw in her previous work. As the cataracts and retinopathy progress, her artwork reflects the damage to her eyes. The transition from realism to an impressionistic approach shows that her talent never wanes, only the way she expresses her subjects. Until, as we said earlier, she gave up art completely, not long, in fact, after the completion of this work. How different life would have been had she been born just a few years later. Her treatment today, once again, early diagnosis, control of her diabetes, her diet, exercise, alcohol, all the important things that we've mentioned before. And we would diagnose her complications early. With the technology we have available today, we should be able to diagnose the retinopathy much earlier, before it causes major problem, and be able to treat it with anti-VEGF injections or steroids, and definitely, if there are problems with vision, using the Maya machine. This brings us to Georgia O'Keeffe, an American artist. Her symptoms only started when she was in her late 70s. She described a cloud entering her eyeballs. She was diagnosed at the time with AMD. I have included Georgia O'Keeffe here to demonstrate that one cannot ever judge anything according to a predetermined pattern. We will see that her art did not change as we would expect with time. In fact, some of her latest works are the sharpest. They are clear, well-defined, and very crisp. The reason? She was not going to give up. She couldn't see, so she got her assistants to help her to paint. And she stated, "I can see what I want to paint, even when unable to do so unaided." So she directed her assistants in exactly what they should be doing. And now we actually have a reversal of the acuity, because her later works, like this flower, are extremely sharp. And if we go back by 10 years, we'll see that the mountain and lake are almost impressionistic, with soft lines and a gentle suggestion of the scene. We can go back in time to one of Georgia O'Keeffe's earliest works, a watercolor produced between 1903 and 1905. And here we see again that it is not reliable to judge vision based on art. This early work shows a softened artwork with little sharpness. Only the thorns and parts of the stems are represented with clear brushstrokes. This may have been a misleading clue about Georgia O'Keeffe's vision at the time, but as it was painted years, even decades before she developed macular degeneration, we can see that this would be a misrepresentation. This is a stylistic art choice. This brings us to another artist, Edvard Munch. Although some may not know his name, there are very few who do not recognize his famous work, or rather works, The Scream. He produced a few versions of this art. And in fact, the painting has been reproduced on t-shirts, coffee mugs, even numerous caricatures. But let's have a quick look at the artist as we go on to examining his art. He suffered from poor health for most of his life. He abused alcohol and had severe mood swings. There is quite a lot of debate about his eye pathology. But let's have a look at what we do know. Edvard Munch damaged his left eye in a fight in 1904. This led to a vitreous hemorrhage in the left eye, but when he developed a similar problem in the right eye as well, healthcare professionals realized that there was an underlying pathology affecting both eyes. We now realize that he might have had central retinal vein occlusion, because his symptoms tend to point that way. Both eyes developed cloudy vision, and he described a black bird's head in his right eye. He also said that when he looked up, he could see other floaters, like a small flock of birds in the sky. He was obsessed with his eyes and annotated his progress every single day. He drew a grid over his artwork to document any changes that he could see day after day after day. And it is thought that when Mark Amsler, an ophthalmologist in Switzerland, saw this, he adopted the principle of using a grid to check for macular degeneration, the progress of macular degeneration, and other conditions that affect the macula. And in fact, the Amsler grid is still widely used to this day. This painting probably shows much of Munch's frustration and his deepening unhappiness about his eye condition. He feared for not only his vision, but also his life. And numerous paintings show this time and again. In this image, the blank pupil with the black spots all around and the haphazard concentric circles attest to his outlook and the gloom that accompanied it. The black dots are probably representative of the floaters that he could see. And when we move on to this image, we see that it also shows his gloom. He occludes his left eye, and we see that then much of his vision is taken up by that ever-present black bird. He measured every aspect of the bird every day: the position, the size, the position of the beak, the distance from the beak to the eye, etc. He did this obsessively, daily, and in this way he tracked and documented all changes in his vision. But of course, Edvard Munch is best known for the screen. One of the originals was sold for almost $120 million in 2012. At the time, it set a record price for the sale of a painting. And of course, anyone looking at this artwork can surely gauge the state of mind of the artist. And finally, as we look at the 10th and last artist that we will discuss today, we meet another troubled soul, Vincent van Gogh. He lived from 1853 to 1890. Van Gogh had multiple eye problems. Many of these were tragically iatrogenic, in other words, caused by the medication that was prescribed for him. He received treatment, including from his beloved Dr. GOGH. The maladies for which he received treatment included epilepsy, persistent headaches, mental illness, nausea, melancholy, eye inflammation and irritation, and most probably early cataracts caused by excess digitalis, and we'll see also some of the other meds that he took. He was given large doses of digitalis to control these pathologies, and tragically this led to a vicious cycle. Digitalis was almost certainly responsible for many of his ongoing and increasing symptoms, and the more they intensified, the higher the dose that was prescribed for him. The higher the dose, the more the symptoms intensified, and the cycle carried on and on and on. And here we have a portrait painted by Vincent van Gogh of Dr. GOGH looking exceedingly gloomy and with digitalis in the same image. Not only will digitalis rather unsurprisingly exacerbate nearly all the symptoms that escalated with time, excess digitalis also causes blurred vision, and it causes a condition known as xanthopsia. Xanthopsia is known as yellow vision, and it is one explanation of why yellow dominates so many of Van Gogh's artworks, and also why we often see yellow or yellow-green halos around objects in his images. If this were not enough, it appears that Van Gogh also had lead poisoning from the lead-based paints. He was in the habit of licking his brushes to obtain a finer line. Lead poisoning causes swelling of the retina and the cornea, resulting in one seeing circles and swirls. We know that lead is neurotoxic, and it can cause or contribute to, and it can exacerbate brain damage. It also causes eye irritation, and we know that Vincent complained of this, and it can cause early cataracts. And then last, but most certainly not least, absinthe. It is not surprising that this toxic drink is banned in most countries around the world. Not only does it cause hallucinations and yellow vision, it also causes seizures, erratic behavior, and mental deterioration. So in all, Vincent certainly had massive problems that led to his famously removing his ear and his untimely death, aged only 37. But he left us an enormous legacy of about 2,100 documented artworks. And now, as we look at one of his most famous works, we can see that it is not surprising that he produced Starry Night. We look now at this magnificent work with increased understanding, compassion, and insight. Those circles and swirls take on an added meaning, and we see deeper into that tortured but magnificent artist. And this brings us to our conclusions, or perhaps in this case it is far more accurate to say our lack of conclusions. Now you can join in as we ask ourselves together: would early diagnosis and appropriate treatment have changed, enhanced, or improved each artist that we have met today's ability? Would early intervention have allowed them to have been more productive? And then let us ask ourselves how much of their work was caused and influenced by each one's visual defects, and of course, how much is attributed to artistic license. Look at each one and ask yourself, would this work have been helped? Would it have been better, improved, if the artist had been diagnosed and treated today? In other words, had he been treated with our modern approach, would we have had our beloved Starry Night? Thank you.